Hello everyone, this is Saman Salim at SS Medics and today we are going to talk about metabolic acidosis and anion gap. So this is one of the most important concepts and it was a very confusing concept for me. So I decided to make a video about it. Let's move forward. So before starting, we should know that what is anion gap. It is basically the measured difference between the cations and anions. Why am I saying that measured difference? Because actually our bodies are isoelectrically neutral. In our bodies, the cations and the anions, they're always in the similar amount. There is no difference in between them, and that is why our bodies are not charged. But when we measured the cations and anions, we only measured those cations which are very easy for us to measure, like sodium and potassium. And for the anions, we take chloride and bicarbonate. And when we take their difference, so there is a measured difference between these cations and anions that is normally 8 to 16, and that is what we call as the anion gap. And this only appears because of the unmeasured anions, which is not very possible for us to measure, like phosphates and sulfates and the charged proteins. So it is very expensive to take all those investigations. So we have said that when we measure the difference between the cations and anions, if the body is normal and if the body is normally isoelectrically neutral, this is the normal difference that will appear in our investigations. So the difference of 8 to 16 anion gap is very normal for our investigations. Now moving forward, when a patient is having metabolic acidosis, so what we are implying is that patient is having acidosis, so pH is less than 7.36. And since it is metabolic acidosis, so the bicarbonate concentration in that patient's body must be less than 22 millimeters of mercury. So when the bicarbonate has decreased in our body, the measured anions, they should also decrease, and apparently the anion gap should increase more than 16. That is what we call as the large anion gap metabolic acidosis, and this is what happens in most of the types of the metabolic acidosis. But sometimes, as you all know, that in various places of our bodies, there are chloride and bicarbonate exchangers. So sometimes what happens is that with every bicarb being lost from our body, a chloride is added to our body. Or sometimes the patients present with like HCl poisoning or ammonium chloride poisoning. And in those scenarios as well, chloride ions are being added into our body. So what happens is that although the bicarbonate is less in metabolic acidosis, but the total anions, they remain normal. The anion gap, it remains normal. And that is what we call as the normal anion gap metabolic acidosis. So when we see a patient in our clinical settings presenting with metabolic acidosis, it is very important for us to know that whether it is large anion gap or normal anion gap metabolic acidosis, because that gives us an insight into the probable cause leading to metabolic acidosis. So now we will look into the causes. So here you can see that large anion gap metabolic acidosis, it has like DKA, ketoacidosis, renal failure, shock, aspirin poisoning, lactic acidosis, methanol poisoning, alcoholism, ethylene poisoning. All of these, they come into metabolic acidosis, large anion gap. The other category, that is normal anion gap, and it is also called as hyperchloremic acidosis, because in these situations, chloride ions concentration in our body, that is more than normal. That is why we call it as hyperchloremic acidosis. And the probable causes are ammonium chloride, HCl poisoning, GID bicarbonate losses including diarrhea, small bowel fistula, or if there is a urinary diversion procedure or renal tubular acidosis. So once we have classified that the patient is having which type of the metabolic acidosis, we have a proper insight into what can be the probable cause, and then we can do our investigations based on that. So this is a very important clinical situation and hope it helps in understanding your concept. Thank you so much for watching this video, and if this was helpful, please like, share and subscribe my channel. Thank you so much.